So. Big breath. And again. So with a bigger guy, I can, sorry. I can more use elbows through, like into the hips. I can just gently apply a little bit of pressure up through the back. How's the pressure? Good? I could use, if I want to go more gentle, I can use my knuckles like this. Or I can use thumbs. He's very tight just in here. I can also bring the arm up and just, or
he's more patient.
So that's a nice way. We can also get the hips this way. We can have the leg out like this, and then just gently apply pressure in here. He's very tight in here.
Тебе там що осталось, які мати, ну що це не мати, нічого. That's what you said, he has a lot of pain, so that's coming from that.
Wow. I like it.
He likes it?
Shaking but liking it.
You can also work like this.
Wow,
This.
new for me.
This is a really nice move.
Oh.
One that's an acquired taste. And in here. I call these treasure troves.
It's
They
really
have-
new for me.
They hold so much energy. Big breath. So we have different bands that we could work on here. We could work on the outer little toe band. We can work on this band coming up through here. And we can work on the Achilles. This is the bottom little toe band in here. So it's not too easy to work on the big toe sacrum band. It's just too close. You don't really want to use your elbow on that one.
Підеш як молодий хлопець.
Що?
Додому підеш як молодий хлопець.
Another nice way to get into the hips, which is even stronger, is to have them on the side. I'll get you in your side, facing.
На бік, подобнись до мене лицем, якщо зараз ви там покажеш.
No, facing the other way. Okay.
Ще один
And
вихід.
usually I put like a towel or a cushion or something under his head.
We could.
Yeah. Some
We
towels.
could.
How many?
Maybe 2, 3. It's quite big, so.
Just get the fire.
Yeah, just a little, just to give him like a cushion, you know, about the length, the distance of his head
Oh.
to his shoulders, so that he's not feeling, otherwise this position will make this shoulder uncomfortable. Big breath. But this is really nice for people, it's only, again, more of a connoisseur's move for people that want deep. Hip. So tight in there. Just sink into it. If you feel like you need to have a rest, you can just
It's really rest.
Yeah. Can also work in through this sacral, the big toe sacrum band. We can work here. If he's really keen, we can actually get into here at the same time. Yeah. And then alternate, and then just gently apply. But the best one for getting in here is this one. It's quite, and you can get right in here. And then just, or this. And then just gently lean. But some people will find this uncomfortable. So you have to do the feet first. Other people just enjoy it.
Especially for sports people.
Oh, yeah.
They gotta get it down because no matter which way.
But you know, probably the absolute best way to do that is to loosen the little toe first. Because the little toe, outer little toe band comes up through here. But once you've done that, then you can get right in there. But I'm going to show, I'll show all these positions. I'm not expecting you to practice all these today. Can't help but throw in a few new things.
That's nice. So we know there's more.
There's more to coming. All right, so.
What is it? Just touch go with this. Sometimes in different positions.
Yeah. Yeah. Oh, yeah. All right. I could keep going. There's a lot more, but I don't want to kind of.
That's alright.